اوكي
شو بك بس هون got it اوكي.
خلاص we're live. Hello, we're live. Hi, Dr.
Hi
Nicole. Hi.
Sandra.
How are you?
Good I'm fine. نايمة شوي عم يوجعوني بلشت تسقع هون بس ماشي الحال. I'm okay. I'm having my cup of tea. I'm fine. انت how are you doing?
All good, all okay. سلامتك. Thank you so much for making the time. تنقول للأودينس أنت عم تفوتي من اليو اس. We appreciate so much. مع فرق الوقت كمان we appreciate so much you giving the time to our community and to Sira. You're new to the team and it's a pleasure and an honor to collaborate with you. هلا بتخبرينا شوي عن حالك يعني الناس يتعرفوا عليك كمان our audience ويعني أنا بقدر أشهد وأقول إنه you're one of the best in the field. Your reputation precedes you and you will be hopefully through Sira you will be tackling different issues that have to deal with the individual and all around our mental health and our mental well-being. نحن اليوم we have a big audience. It's a very very interesting topic. Most of us have experienced panic attacks at some point in our lives. Sometimes we don't know or we can't identify that there are panic attacks فما بنعرف إنه نحن we are going through something. وفي منا يمكن بعد ما وصلوا لها بس عم نعيش هالستريس وعم نعيش ضغوطات من كل الميلات وبدنا نكون preventive تا ما يصير عنا panic attack. So إن شاء الله اليوم معي كمان بنقدر نتعلم كيف to also prevent إنه ما يصير معنا panic attacks. في كتير ناس اليوم دكتور عم بيسمعونا وفاتوا يحضروكي لأنه they are suffering from يعني منهم مرتاحين بجسمهم وعم بيحسوا إنه في شيء غلط. فحابين يعرفوا منك كمان كيف أول شيء امتين بنقول او كيف بنعرف انه هيدي بانيك اتاك. شو مخاطرها وكيف فينا نتجنبها واذا في طرق تنتجنبها واذا بتنصحي بالميديكيشن ولا لا. كمان هيدي اسئله كتير تخطر على بالنا. كمان يمكن نحكي شوي عن anxiety معك. كل هالمواضيع اوريدي الاودينس تبعنا ناطره تسمع منك الليله. وللي نيو جوينرز لسيرة أنا I just give one minute هيك بس تنقلكم شو رح يصير معنا. نحن اونلاين بلاتفورم مثل ما بتعرفوا صرتوا that handles or that focuses on mental health. والmental health بالنسبة لنا الكونسبت تبعها هي everyday struggles. So everybody needs mental health and mental health awareness. Through Sira we have round tables weekly مثل اليوم when an expert, a mental health expert بيحكي معنا he or she moderates a round table. We interact with you through the round table through chat. So هلا رح تقشعوا قدامكم Q&A. So فيكم تسألوا أسئلة through chat. تواصلوا معنا through chat. Please in the Q&A make sure that you تحطوا الاوبشن تبع anonymous to be anonymous so that your name doesn't show in the recording لأنه نحن we are live but we are also recording. So you have the option to keep your identity private when asking your questions. هيدي أول شيء. اثنين تقريبا 45 minutes نحن رح نقضيه بالراوند تيبل مع دكتور نيكول. من بعدها رح ننقل على virtual room رح نفسر لكم كيف. It's like a chat room رح ننقل كلنا عليها. وهالvirtual room ما بنسجل أبدا. We become an intimate group. بتقدروا تطلعوا على الكاميرا بتقدروا تفتحوا مايكروفون إذا أنتم مرتاحين. تقدروا حتى تسألونا أسئلتكم anonymously. فيكم بس تتسمعوا. فيكم تتواصلوا معنا بالطريقة يلي مرتاحين فيها. فيكم ما تفصحوا عن هويتكم. الفكرة أنه نتواصل أكثر مع دكتور نيكول نسألها cases نسألها أشياء شخصية أشياء عشناها بحاجة للguidance تبعها ودعمها. So you will move with us to the room بعد شي 45 minutes. We will teach you how. Also on the Sira platform every Tuesday and every Thursday we have a psychologist and a psychomotor therapist who are here to support you. So you can see them also privately for 20 minutes. بيطلع لكم 20 minutes free to talk to them and they can support you in all kinds of struggles. بلا ما نتأخر أكتر دكتور نيكول عارفين عن حالك and let's dive into our topic tonight. أنا رح راقب الأسئلة والchat بذات الوقت، ووقتها بدك إنه الaudience تبعنا يبلشوا يعبوا polls. Let me know so that you can tell them also.
Sure. Thank you so much, Sandra, على introduction, and also very helpful, I think, to explain, what CETA provides. And Anna Kamin, it's a pleasure for me to be a part of the team. I'm looking forward to this. I'm quite passionate about raising awareness, and this is exactly what CETA does, خصوصاً بالمجتمع العربي. And as we know, we need a lot of awareness. Really happy to be a part of the team. So مثل ما ذكرت اليوم رح نحكي عن panic attacks. شوي عن حالي يمكن قبل ما نبلش. So I'm a clinical psychologist based بأمريكا هلا. قبل ما انتقل لهون كنت بلبنان بآخر 2020 تقريبا. نقلت وكانت من وقت الحوادث، يعني كله هيك كان تراكم ورا بعضه. So حسيت إنه it's time for me to leave. وإلا أكيد يعني ما حدا بيحب يترك بلده. I would have loved to have stayed there. بس الظروف يعني حكمت. So I left and I'm here now and I have a small private practice. أكثرية السيشنز اللي بوفرها للعالم is online. So I work a lot مع أكثرية العالم اللبنانية بيكونوا عايشين برا أو بلبنان. So I provide sessions online أو كمان in person. And if people want to learn a little bit more about, what I do, what my approach is, I do have a website. So I'm just going to signpost people to the website هيك بيعرفوا عني أكتر so we can dive into today's topic. So the website is meadowspath.com. So that's MEADOWS path, PATH.com. All right then.
And I'll share يعني people أكيد they have your bio on the platform on our app, and I will also share on the chat your website كمان for reference.
أكيد. Sounds good. So I'm gonna go ahead and try to pull up my PowerPoint here. Okay. مبين كل شيء عندكم okay? Perfect. Okay. I just realized that my slides are gray and I'm wearing gray and it's winter, so كله gray. So موضوع اليوم حيكون عن panic attacks. Of course, we're going to be talking about شو هو البانيك اتاك، شو بيسبب البانيك اتاك، شو العوارض، وشو هو التريتمنت للبانيك اتاك. And then towards the end, we're going to talk about some techniques or strategies to try to alleviate these types of symptoms. وبالاخر عنا شويه هيك take home messages. ومثل ما ذكرتي ساندرا بعد ما نخلص من lecture part ننتقل على الأوض and we can ask some more personal questions there. This doesn't mean that I don't welcome questions now. إذا حدا بيحب يسأل أسئلة at any point, please put them in the chat. وأنا at my own pace, I will look at it and address it. So قبل ما نبلش بالtopic, let's test our own knowledge. I have a few statements. المطلوب منكم بس تجاوبوا true أو false. So let's start with that. I think Sandra, you have those, right? So the first statement is, it's unusual to experience a panic attack in one's lifetime. Sandra, أنت بعتيهم لأعرف.
polls. So please قدامكم على الاب you have a tab اسمها polls بتبين قدامكم على الاب. Just click on polls بيبينوا الأسئلة قدامكم واعطونا رأيكم إذا true ولا false على كل statement بتحطها دكتور نيكول. هيك تنشوف إذا يعني نعمل إحصاء شوي. What do you think and if the facts are correct ولا لا. So if you can please just answer the poll.
We'll allow a few more minutes for them to do that لأنه إذا بكبس next slide حيبين الجواب. So I'm just gonna leave it at that till people answer and then we can look at the results.
People بلشوا يعرفوا على polls. يلا we're starting to see results.
انتبهت عليك ساندرا، كنت عم تحملي بكلة وأنا كمان في بكلة قدامي.
It's a stress release. أنا عم ذاكر بس الناس إنه they can ask their questions in the Q&A and they can choose to ask anonymously if they don't want their name to appear in the recording.
Yeah, أكيد.
نحن بنحب نذكر كمان انه all our sessions on the app فيهم يرجعوا يحضرون a replay of all our sessions, all our round tables. They can go back in time and watch any of the round tables. وكمان كل شيء بيكون موجود على يوتيوب. All our sessions كمان. So بكرة دكتور نيكول فيهم كمان يحضروك على اليوتيوب the recorded part of it.
Wonderful. Yeah, I'll make sure to share the link with some people who couldn't attend اليوم.
Okay, so we're getting answers. قولي لي وقتها بدك نوقف.
عندي إذا they all submitted يمكن من عندك it shows إذا the majority have answered I'm happy to see the results.
Yes. So بدك الريزلت لهيدا الجواب. It is unusual to experience a panic attack. Okay. 100% false.
Okay, good. That's right. So it's actually common for people to experience a panic attack. The research بيدل إنه around 1/3 of people will have 1 or 2 panic attacks in their lifetime at some point. So great job, everyone. So the next one, only people with an anxiety disorder have panic attacks. True or false? شو جاوبوا؟
That's a tough one. False.
That's right. Yes. So you don't have to have a mental disorder to experience a panic attack. Anyone can have a panic attack.
Okay.
ثالث شيء, panic disorder is more common in men. True or false?
90% false, 10% true.
Okay, so the answer is false. Actually, it's twice as prevalent in women than it is in men. And we'll talk a little bit more about that later.
Interesting.
Symptoms of panic disorder often start in childhood. هيدي كمان حسيتها شوي tricky. شو كتبوا العالم؟ شو جاوبوا؟
72% false and لا أكتر 75% false و 25% true.
Right, so it is false. Actually, symptoms of panic disorder start in late teens or early adulthood. This does not mean that a child cannot experience a panic attack, but نحن عم نحكي in general as a disorder and such, it would start بهالفترة.
Okay.
Most panic attacks peak after 30 minutes. شو جاوبوا؟
54% true, 45% false. كتير قريب.
Yeah, so it's false. Actually, a panic attack peaks at about 10 minutes, and on average, the whole duration of a panic attack is around 30 minutes. Again, we're talking averages, few exceptions for sure. It's possible to have a panic attack while sleeping. What did people answer?
83% true, will be false.
Yes, it's true. Actually, it is possible to experience a panic attack while sleeping, and the technical term for it is what we say nocturnal panic attack. All right, thanks guys for participating. بحب أنا عادة with these types of lectures يكونوا شوي engaging. Otherwise, I feel, at least personally, they can become a bit dull and boring. So again, I welcome questions at any point.
We love the engagement.
Good. So what is a panic attack? By definition, a panic attack هو episode لما شخص يكون عنده intense fear or anxiety وعادة الريزلت تبعوله بيكونوا physical symptoms. So أكيد we've heard people say نفسي ضيق, ما عم بقدر أتنفس, I'm shaking, I can't control my breath, I feel like I'm having a heart attack. So a lot of the descriptions of panic attack are about the body, how the body reacts, because this is really what goes on. We feel it in the body. There are physical symptoms. وفي إذا بدك نوعين of a panic attack. So first type of panic attack is what we call expected or cued. And the second type is what we call unexpected or uncued. So let's give an example of that. An expected panic attack, say, would be, for instance, if I had claustrophobia, اللي هو الخوف من الأماكن المسكرة, if I know that I'm going to be entering an elevator, I will predict, no, most likely, I'm not going to be able to catch my breath. It's going to feel very tight on my chest. So when we talk about it being expected or predictable versus an unexpected or uncued, it can be really, really terrifying because it's unpredictable. It can happen at any time. So just to hold in mind that panic attacks can have cues or triggers, so to speak, or they can be very random. As we discussed, most panic attacks will peak at about 10 minutes, وعادة they will last for 30 minutes, but this is not to say that I haven't heard people tell me it's lasted for hours. You know, I remember working with a client who really struggled with panic attacks, and more specifically panic disorder. وحنحكي عن شو الفرق بين panic attack و panic disorder. بس الشخص اللي عم بحكي عنه كان كتير يعاني من هيدا الشيء، وكانت تطول for like 2-3 hours, you know, so you can imagine قد ايه كانت هيدا الشيء tiring للشخص. It's very common for people to think they are having a heart attack when they have a panic attack, and this is why sometimes we'll see people عم بيروحوا على emergency room بدهم يطلبوا يشوفوا حكيم لأنه خايفين ما يكون في شيء medically unexplained, أو بيعملوا كمان excessive test, you know, blood work كذا, just to check إنه maybe there's something that explains my symptoms. أكيد نحن بنشجع إنه with any mental health condition, anything that we experience, we want to rule out إنه في medical cause. So أحياناً بنخبر الشخص إنه yes, go get your general checkup done with a doctor. If everything is ruled out, we have to start considering إنه ممكن هيدا الشيء يكون شيء psychological. Panic attack كمان might be a symptom of other mental health disorders. So إذا في شخص عنده PTSD اللي هي post-traumatic stress disorder، أو عنده OCD اللي هي الوسواس القهري، depression اكتئاب أو substance abuse disorder، كمان in addition to these things they might be struggling with panic attacks. أكيد one of the worst things to know about a panic attack is that because it's so intense and so uncomfortable بيكون في خوف إنه الواحد يرجع to experience it, you know, so it's the fear of the fear itself, you know, it becomes a bit of a vicious cycle. And if this becomes very frequent, very intense, it's what we call a panic disorder. So let me just clarify. If I experience a panic attack on one occasion or 2 occasions, it's not enough for me to classify it as a panic disorder. It's a disorder altogether, إذا كتير بيصيروا frequent, and if this starts interfering with the quality of my life. So لما أنا أصير كمان أتجنب مثلا أطلع برات البيت لأنه خايف يصير عندي panic attack، هيدا الشيء ممكن then to be considered a panic disorder. So it really matters على الfrequency وعلى how it affects my daily life. As I just mentioned, sometimes these panic attacks can create so much fear for people that they avoid situations altogether. So again, الexample اللي كنت عم بعطيه، إذا شخص عنده claustrophobia أو بيخاف من tight places, this person might avoid ever going into an elevator and will, you know, walk the steps no matter how many steps there are, just because they don't want to risk having a panic attack. So avoidance is a common, if you want, safety behavior to deal with panic attacks. So causes, you know, I hate to say this, but we don't really know what the cause of a panic attack is till today. تخيلي Sandra, يعني it's 2022, we still don't really understand what the cause is, but we do know that there are certain risk factors that play a role. So risk factors هن major stress. An example of major stress could be حدا توفى بالعائلة, حدا عنده مرض, very serious illness. These are major stresses. Traumatic event, as the name suggests, يعني بعد ما واحد يقطع ب experience يعني صدمة. And أكيد this is subjective. يعني what is traumatic to you might not be traumatic to me. So for instance, for some people, a divorce or childbirth, you know, those could be traumatic events. History of child abuse. Child abuse ممكن يكون physical, ممكن يكون sexual, ممكن يكون emotional, psychological, any form of abuse could play a role. Smoking or excessive caffeine intake. So إذا كتير بنشرب قهوة, إذا كتير بنشرب كمان Pepsi وهول الأخبار, anything that contains caffeine, these could increase the likelihood. And we don't know exactly كيف the genetics plays a role, بس نعرف إنه panic attack runs in families. So if there is someone in the family that happens to experience panic attacks, في نسبة عالية إنه other people will experience it too. But again, as I say, we don't really understand what causes panic attacks. One thing that we do know, كمان, about panic attacks is when when we experience it, it seems to activate what we call the sympathetic nervous system. So شو هو sympathetic nervous system? إذا مثلا هلا إجا a tiger to attack me, automatically my body and my brain are going to go into fight, flight, or freeze mode, اللي هو يا أنا بدي حارب هيدا الشيء يا بدي أتهرب منه يا I feel stuck and I don't know what to do and I'm just there, I'm frozen. So this is a natural response for our body to protect us, essentially. And اللي نحن بنعرفه عن panic attacks is that something along those lines is also activated. Our sympathetic nervous system seems to be activated لما يصير عنا panic attack, حتى لو ما في شيء per se that is a real danger. You know, it's not like a bear or a wolf is attacking, but there's a perception of a threat somewhere, right? So شو هن the symptoms of a panic attack? They are actually
بالsymptoms. هل في cues يعني إذا بنرجع شوي على الكوزز مثلا بنلاقي إنه مرات في ناس they go through multiple stress events ما بيصير عندهم panic attacks ومرات it's not a major stressful event per se هلا and then a panic attack يعني بتبلش. Is there في شي rule ولا it's totally random?
Well, yeah, that's the thing. It can be random. You know, that is a panic attack by definition. It could be a sudden episode. At other times, it's not. But أكيد في strategies نحن that we can try to practice it to cope with our level of stress and anxiety, which we'll get to at the very end, because it's really all how we respond. إذا بدك. So أوقات في أشياء بنقدر نحن to practice it. It could reduce the likelihood of a panic attack happening. But is there a way to eliminate it altogether? Actually, no. You know?
Okay.
Yeah. So actually, on that note, does anyone else have any questions? We can take a pause here and see.
Is there anything physical? هيدا سؤال كمان عم نسأل إنه يمكن نقص بفيتامينز معينة. Do you think it has something to do with hormone levels? Anything correlated to biology or not?
Yeah. So this is why we say for anyone who's experiencing these types of symptoms, أكيد the first thing to do is consult with a doctor to check and be any other explanation. مثلا نقص بالفيتامينز هرمونات كل هالقصص. بس إذا كل هول came back and ruled out to be negative, again it only reconfirms to us إنه هيدي experience is in fact psychological in nature. It's a panic attack. Any other questions, Sandra?
لا not مش لهلا.
Okay. All right. We have about 20 minutes left.
Yeah, take your time. يعني عندك لل 20-25 minutes.
Good. All right. So moving on to symptoms. I'm just going to leave that up there for a few minutes. لا تتفرجوا عليها. What you're going to see is the majority of the symptoms we're looking at خاصة physical sensations. Chest pain, chills, excessive sweating, nausea, shortness of breath. كل هول they are physical sensations. وفي أشياء تانية كمان in addition to those things اللي أنا حطيتهم بالbrackets as T. These are thoughts or ideas that people also have when they are experiencing a panic attack. So for a lot of people بيخافوا إنه they're losing control, بيخافوا إنه they might be dying. كمان كتير في expression of they feel detached, you know, like that they're not really in their body or that something doesn't feel real to them. So these are also common feelings that people might have when they're experiencing a panic attack. Technically, as per the DSM, the DSM هو Diagnostic and Statistical Manual for Mental Disorders. So it's kind of the book of mental disorders. According to that, for people to have a true experience of a panic attack, they should have 4 symptoms out of the 13. شو ما كانوا ال4 بس يكون عندهم 4 out of the 13. I'm not a big fan of, you know, categorizing things in that way. I think, again, everybody responds differently. But at least it helps, I think, practitioners communicate with each other and understand what a person might be going through. But anyhow, that's just FYI يعني إذا حبيتوا تعرفوا. Okay, so شو الفرق بين panic attack heart attack. So the panic attack symptoms I've put on the left and the heart attack symptoms I've put on the right. So a panic attack is typically when a person feels that there's a stabbing pain in the middle of their chest, and the pain actually gets better over time. It doesn't get worse. And أكيد في دقات قلب سريعة, هيدا it's very common. Really, the main difference is the pain gets worse with a panic, with a heart attack, and بيكون في العيان and other symptoms. So there's definitely differences there, but I can understand why for a lot of people it might feel like the same thing, you know, especially لأنه نحن we might not have experienced what a heart attack is. So if we experience a panic attack, we might mistaken it to be a heart attack. But yeah, this is just take it for people to keep that in mind. So in terms of treatment, treatment for...
Very interesting, لأنه such a very sensitive topic of medication. Should we medicate or not?
Right, yeah. So actually, part of the treatments for panic attacks are either psychotherapy, اللي هو talking therapy, أو العلاج من ضمن الحكي, as in seeing a psychologist, or by medication, which is to consult with a medical doctor or a psychiatrist. And the research shows actually that either of them alone or both of them combined can be helpful على حسب كمان كل شخص والحالة تبعيته, because مثل ما عم فسر لك اليوم Sandra, it's very hard to say, okay, this person is only dealing with a panic attack. There might be a bunch of other things. There might be a history of trauma. There might be depression as well. So كل case by case تختلف. So إذا عم نفكر إنه psychotherapy, what the approach is, في شيء اسمه cognitive behavioral therapy, or CBT for short. And basically what this approach is about is helping people to change the way that they think and helping them to also change their behavior. And it's thought بهذا الapproach إنه changing beliefs, changing behaviors بيساعد الشخص. So example of what a CBT approach might look like for panic attacks. First thing that we might do is to educate the person on what a panic attack is. And, you know, this might sound like something very small, but trust me, it comes a long way. You know, a lot of people walk through the door thinking what they're having is XYZ, and to be told actually, no, it's this, can bring a whole lot of relief for people. So هيدي النقطة اللي هي نحن بنسميها psychoeducation is very important. تاني شغلة
يعرف انه هي بانيك اتاك، يعرف شو هي السيمتوم، يعرف هاو كومن. يعني في كتير ناس بتستحي تحكي او هيدا بيفكروا انه انه هن ضعاف او هن مش عم بيقدروا يتخطوا الامور، انه هي ساين ضعف. فرجيتينا statistics 1 out of 3 is very common.
Exactly. So مثل ما قلت Sandra, يعني having conversations around really what is a panic attack, how common is it, and what does it mean, and providing that context and understanding really helps. تاني شغلة what we would do is we would encourage a person to monitor how often does the panic attack happen. Is there any potential trigger? مثل ما قلت لك, for some people في cued things, في other people ما عندهم any cues. So we would encourage them to monitor, especially for someone that reports having frequent panic attacks. We would want them to keep a diary and to write these things down. ثالث شغلة بدنا نعلمهم كمان شو هن breathing and relaxation techniques and how to do them. We would practice it with the person this session, and then also ask them to do it outside of a session. And we'll talk about that later. That's super important. And then work towards changing the belief. يعني مثلا, one belief that someone who has a panic attack might have is أكيد أنا رح موت. أكيد هيدول الsymptoms يعني أنا رح موت وأنا ضروري هلأ أروح شوف الحكيم. This could be the fixed belief or rigid belief that they have. Maybe over time we can help them to reframe that thought for it to look something like, okay, I know these symptoms are annoying and they're tiring me, and I wish they weren't here, but I'm fairly certain this is a panic attack. You know, ideally, that's what we would want to then shift هيدا thought to become. And then lastly, we would also encourage exposure, because if you remember a few slides back, I was talking about how one safety behavior is avoidance. إذا أنا عارفة being around someone or going to a certain place is going to result in me feeling anxious or to have a panic attack, بطبيعة الحال I want to avoid it. I don't want to put myself behind that position. بس الavoidance على المدى الطويل حيكون more problematic because it could keep a person isolated and withdrawn, you know. So we want to create a safe space for them to slowly go back to these places that might cause some anxiety, but to do so in a gradual way. And after practicing all of those techniques that we talked about. بالنسبة للmedication, normally what would be prescribed for individuals with panic attacks could be either antidepressants or anti-anxiety medication. And people might be thinking, oof, le antidepressant, it's not a depression. So why is it? Yeah. So the reason why it is because these types of medications, they work on the brain very differently. And so without going into too much detail about that, sometimes even though a panic attack is more of an anxiety presentation, the way that an antidepressant medication might work on the brain is more effective. So al-Hakim Akid is going to have to be the one to decide, what is best for each person's case. And then also in some cases, anti-anxiety medications can be more, what's the word I'm looking for? It could result in a dependence. It could result more in a dependence than antidepressants, if not monitored properly and so on, because they have more addictive properties. So anti-anxiety medication, مثلا Xanax, Valium, these would be anti-anxiety meds.
So addictive antidepressant, مشان هيك مرات بيوصفوا أكتر antidepressant. Okay.
And again, because these types of medications will work differently on the brain. So على حسب each person's case, like we said, panic attacks might present alone, but usually it doesn't. Usually بيكون في كتير أشياء تانية عم بتصير بنفس الوقت. So, and like I said,
sorry, go ahead.
I was just going to say, in some cases, the recommendation is therapy and medication. So that's also something to hold in mind.
So سؤالنا إليك exactly on this point. يعني في ناس دكتور نيكول مرات بس يحسوا إنه something is changing, they are going through إن كان anxiety إن كان depression أو حتى a panic attack, ما بيحكوا مع حدا ولا بيلجأوا لحكيم وبيلجأوا دغري للميديكيشن. وفي countries ما بدك حتى prescription، يعني بتفوتي على الفارماشية بتقولي إنه أنا عم بحس هيك ضيقة نفس وهيدا أو معصبة، أو يعني فيك تشتري الدواء وتحكمي حالك، أو الجارة تحكميك، أو الانتورا، يعني السوشيال سيتنج يقول لك إنه إيه مثلا جربي هيك جربي هيك. شو رأيك أول شيء بهالشغلة؟ اثنين، كمان شو رأيك بالناس يلي دغري بتلجأ لسايكايترست ودغري بتبلش بالميديكيشن من دون ما تقطع بالسي بي تي، بالتغيير الأفكار، بالبريذنج تكنيكس، تيرجعوا على السورس تبع الانكزايتي كمان. What do you think؟ إذا هي بس medication alone, do you think it's effective?
Yeah, so in some cases, it can be effective, actually. So again, the treatment is CBT alone, medication alone, or a combination of both. So عندي كل الثلاثة options. So long story short, it can be effective, but on the note of people self-medicating, I think it can be very, very, very dangerous. And خصوصاً يعني بالمجتمع العربي, it's more encouraged, I think, for us to think about medication, because think of it this way. إذا الواحد بيوجعه راسه، أوكي خد حبة بنادول. إذا something else، خد حبة ما بعرف شو. So even when it comes to mental health, it's not far-fetched. The first way to think of treating it is medication. For some people, it helps. Again, though, case by case, it's very difficult to answer that question just as is. But definitely على موضوع الself-medicating, هيدا الشيء ممكن يكون very dangerous. So we always want to make sure that we're consulting a qualified medical doctor who's specialized in these things, who can again provide us مثل ما قلت بالpsycho education، يفسر لنا طب شو الفرق بين كل هالأدوية، ليش أنا عم قرر أعطيك A ومش B, you know. I think having those open conversations is important. بس كمان sometimes we believe إنه خلص the doctor knows it all. إنه ليه بدي أنا أسأل أو أعرف أكثر. But I would encourage people to ask, you know, be curious, know about the side effects, because كل دواء, even Panadol, right? Every medication has a side effects. You just want to weigh the. Am I still connected? Wala, something.
Yes, yes, yes.
All right. Any other questions?
عنا سؤال, can anxiety be expressed in being dull or unmotivated? Is it a sign of anxiety لإلك إذا a person is ما عنده حب للحياة, dull أو ما عنده motivation?
As a standalone, the way the person has worded it, that sounds to me more to be related to mood. So I would think more of depression. But then again, in reality, it's in clinical practice, لما الشخص يعاني من anxiety, we don't see just anxiety, we see also some symptoms of depression. So دايما بيكون في شوية overlap بين الاثنين. So yes, it's possible إنه a person that struggles with anxiety يكون عنده low mood, you know. So imagine if I'm very anxious, عندي social anxiety وما بقى عم بطلع وعم بشوف رفقاتي وعم بقعد بالبيت أكترية الوقت, of course this will also result in some low moods, right? So usually there's a bit of an overlap with these things, you know. Okay, so moving on to the fun stuff. So breathing techniques. Why are breathing techniques super important? لأنه if we think back to the symptoms we were talking about with the panic attack, most of the time people feel like they have a shortness of breath, دقات قلب سريعة, ومثل ما شرحت لكم بيكون فيها fight or flight response that's happening in the body. So نحن من واجبنا to remind the body إنه wait a minute, you're probably, you know, signaling all of these alarms to me that something is terribly wrong, but is there really a danger here? So نحن بدنا نذكر البody to calm down and to restore هال relaxed state. To restore this relaxed state, we do it through breathing exercises. So this is really the importance of breathing. You know, sometimes I get people looking at me إنه عن جد هلا breathing exercises إنه بوقتها أنا رح أعمل breathing, and I say, well, maybe مش بلحظتها, but practicing these techniques beforehand can make you feel more equipped to when it does happen. So again, there's this idea of practice things قبل بوقت, preventative measures. We don't want to wait for things to get super, super bad for us before we think of هول القصص. So the breathing techniques can reduce the severity and the duration of a panic attack. And our goal here is not to make the panic attack disappear, but it's to make it manageable. I know بعرف كنا كاتبين بالدescription تبع اليوم إنه how do we make it stop?
صح.
We can't really make it stop. It's more about managing it so that it doesn't feel super overwhelming for us. And that is what success looks like. This is how we progress really through it. So on the note of breathing techniques, so there are a couple of strategies that I'll share with you right now. So for instance, في شيء اسمه 4-7-8. ما بعرف إذا حدا هون is familiar with it, but what it is for 4 seconds نتنفس from our nose. For 7 seconds, we hold our breath. And then for 8 seconds, we release from our mouth. And we can do this multiple times as long as till we feel إنه relaxation or calmness is restored in the body. I really like this technique because it can be done anywhere. I could be driving, I could be in an office, I could be at home. I can just sit down and just do this technique. So this is a technique, again, that I would encourage people to do regularly, okay, whenever they feel like they might be experiencing stress or anxiety. And akid, if you are able to do it during a panic attack, that would also be wonderful, you know, as best as you can to try to regulate the breathing. I know that's much easier said than done, but it is encouraged to do. Another type of breathing technique that's really nice is laying on our back. And while we're laying on our back, تعرفي كيف بيحطوا أوقات مثل pillow تحت الكnees when you're like at a massage place or something? Yeah, so you can put a pillow under there and place one hand on your chest or another hand on your stomach and then to also breathe from the nose and then back out from the mouth. والواحد يكون عم بيركز على the stomach expanding and getting smaller throughout this process. So in this way, again, we're slowing down the breath and we're regulating breathing. هول two techniques I can think of, but there are plenty of other versions of breathing exercises, which I can share later on إذا بدكم. Other helpful techniques. Go ahead.
Well, قلتي شغلة إنه we cannot stop panic attacks, we can only manage them. أنت قصدك in the moment ما رح يوقفوا، بس إذا اليوم نحن عملنا هالتوك ثيرابي وإنه we practice breathing techniques وحلينا إذا بدك السورس وطينا الستريس بحياتنا، ما بيروحوا، ما بنخف، ما بيخفوا البانيك اتاكس او ما بيقعدوا يجوا.
ممكن يخفوا بس we want to have realistic expectations, and being in therapy doesn't mean انه رح نوقفهم altogether. You know, that's quite that's a hard promise. Yeah, it's a hard promise to keep. So reality انه ممكن تصير بس how we respond to it will change over time. ويمكن الفريكونسي تبعوله كمان تخف مع الوقت، بس انه يروحوا completely altogether is very unlikely.
Okay.
Yeah. So another type of helpful strategy is something we call guided meditation. وعندي هون link. ما بعرف if people are feeling up to trying this لأنه it's about 10 minutes long. And if we really want to do this together, I would hope that we could immerse in it fully and do the instructions. I don't know, Sandra, what do you think? Do we do it today or do we give it a skip? ما بعرف.
خلينا ناخد كم سؤال و then we can بركي فينا نحط اللينك كمان أو نحضر شقفة منها. We can post the link الناس فيها ترجع تحضرها. What do you think? لأنه عنا أسئلة.
Sure.
Okay. So أول سؤال عنا إياه إنه I'm doing a CBT I'm currently under medication Cipralex after following up with the psychiatrist. No, I'm feeling great and much better. I can manage it well, but still struggling with some specific situation like fear of flight. So what do you think? What do you think is يعني what's your comment? في شيء ينعمل بعد؟ should مثلا exposure فينا نطبق هون exposure على fear of flight? What would you recommend this person?
Right. Yeah. Well, I mean, I congratulate the person for seeking help. That's first of all. It's very hard for us to say, okay, I'm gonna work on myself and talk about it. Again, avoidance is much easier. So, I congratulate them for doing that. تاني شغلة إنه continue with those things because you're already seeing some sort of improvement. Whether it's CBT or the meds or both of it, something is clearly working. So I would strongly encourage you to continue with that. And thirdly, to discuss with your therapist the موضوع of the fear of flying. And there are certain techniques and ways to manage that. And yes, it's, as you said, Sandra, it's something we call exposure therapy. And it will be up to the therapist and the client to agree on how to go about it. So for example, if I have a fear of flying, it might be so overwhelming for me to imagine ever getting on a plane. But the first step might be to talk about those fears and to maybe watch certain videos around flights or to do some types of guided meditations with my therapist. So what I mean to say is كل شيء بينعمل gradual way at a pace that works for the client. So I would encourage this person to talk to their therapist about this specific fear and put a plan in place to work towards.
بركي كمان some breathing techniques يعني أنا اليوم كمان عم بتعلم منك ومن غير عملنا session كمان مع another therapist عن anxiety I was surprised إنه breathing و meditation is included in the يعني بالprotocol of dealing with anxiety and panic attacks. هل هالشيء جديد دكتور نيكول ولا له فترة وقد ايه بتشوفي انه effective تطبيق البريذنج؟
Yeah, so منه شيء جديد. Actually, it's part of the protocol, as you said, and I was assuming actually that the person who asked the question might already be familiar with these types of techniques and other things if they're working with a CBT therapist. And for sure they could help, يعني, as we said, to manage stress and anxiety بشكل عام. يعني انسى موضوع panic attacks or depression or anything like this. But in general, هول التكنيكس بيساعدوا. They've been around for a long time, Sandra, but I think more in the last 10 years, they're gaining attention. But they've always been around. We've always known that they're effective. بس هلا عم ينحكى فيهم أكتر. And being practiced more كمان in different settings. يعني حتى مثلا, you know, for children in school, you know, a long time ago, mental health wasn't something that they would introduce in schools. Now they do, including also mindfulness and breathing and whatnot. It's being introduced. So I think the implementation هو اللي اختلف إذا بدك. It's always been around, but we're implementing it more now.
نحن عملنا حتى this week، أنا بشجع الأودينس إذا كمان عندهم أولاد who experience anxiety or panic attacks. To your point, Dr. Nicole, عملنا session مع a meditation. She's an expert on meditation and breathing. وعطت session كرمال الأولاد. so بتشتغل مع الأولاد ومع الأدلتس. مثل ما قلتي صارت كتير هلأ يعني في عليها focus وعليها هيك مثل تركيز إنه it could be one يعني it's an essential كأنه it's an essential part of getting to know your body and connecting with your body و calming this nervous system مثل ما فسرتي.
Yes, absolutely. In the interest of time, Sandra, I don't think we'll show the leaves on stream, but I will definitely send it to you. هيدا تقريباً it's a 10-minute video. The link is يعني, to YouTube. But it's a type of guided meditation, and I would encourage people to also try that on their own, you know, whenever they have the time and space. I don't know what everyone's situation is like. إذا حدا بالبيت أو على الطريق عم بيسوق. So let's just leave it for another time. The other thing to consider is something we call progressive muscle relaxation. So what this is basically a technique to not only focus on slowing the breath, but also to relax our muscles. And we do this by tensing the muscles and then relaxing them. So for example, is it to make a fist and to hold it really tight for a few seconds, and then after a few seconds to release it. That's one part, if you want, of a progressive muscle relaxation. I have links. Sorry, I have links. I have my own voice as a facilitator or guide to these types of exercises on the website. So you're free to have a look at that on my website. Again, you're free to go through YouTube and just type in progressive muscle relaxation وبتلاقوا حدا who's guiding you through this process. هيدي النقطة هون, it's super, super, super important. Acknowledge. So what do I mean by acknowledge? Let's say أنا عصبت من شيء, and during my experience of anger, I started telling myself, يا الله ليه هلا عصبت؟ إنه ما كان لازم أعصب وليه هيك and I started speaking to myself in this way. Guess what happens? I only feel worse. Instead, with whatever you feel, we want to embrace it. Acknowledge إنه that feeling is there no matter how uncomfortable it is. نفس الشيء مع البانيك أتاك. إذا صار معنا panic attack and we started telling ourselves ليه هلا صار معي البانيك أتاك وأنا I've been trying to do this or I've been trying to do that, هيدا the inner critic voice can only make the experience of it worse for us. So I tell people to listen to that compassionate voice that says, okay, it's a panic attack. I really don't like this and I wish it were to go away, but I've been here before and I can push through it and it will pass. So acknowledge whatever feelings come up for you guys. هيدي قصة tip the temperature. The last point here is if we were to splash cold water on our face, كمان هيدي it will have a different response for our body and our nervous system. So it helps to actually calm us down when we're in the midst of a panic. So كمان just something to hold in mind for some people is to just splash cold water on their face. Okay. Lifestyle changes. So we talked about how too much caffeine can result in us feeling on edge or could somehow be a risk factor in the onset of a panic attack. So this is something you can try to do. Limit your caffeine intake, be more physically active with your body, make sure you're getting enough sleep, and try to practice being in the moment. You know, a lot of the time, Sandra, بنلاقي حالنا عم نفكر on the future or on the past. And if we're doing either of those things, ما بنكون عم نركز على الوقت الحاضر. So just be aware of where your mind goes to a lot of the time. And here's a, simple acronym of healthy eating, physical activity, and sleep. These are ways to live by, to prioritize these things. Take home messages. So although a panic attack can be very painful and frightening, we want to think of them as unpleasant but not intimidating. يعني مثل ما قلنا في certain techniques ممكن يساعدونا. Although they're not comfortable, they're not dangerous, and they will pass. And relaxation techniques can help to lower our anxiety levels and increase this sense of self-control. And lastly, by continuing to practice, restoring a sense of calmness in our body, it's likely that the panic attacks will become less frequent and less frightening. So that's it for this part of today's segment. I think if anyone has any questions, hold on to them and keep them in mind so that we can talk about it in the other room where it's a bit more private. It won't be recorded. And you're free to turn on your camera if you want. إذا ما بدكم كمان فيكم to be anonymous على راحتكم. But yeah, I think that's all I had for today بالنسبة lecture. And if anyone wants to get in touch with me, my details are here. That's the email, the website, and my Instagram handle. And thank you all for your attention and also those really thoughtful questions.
Thank you لك دكتور نيكول. بعد عنا سؤال بركي بناخده هون قبل ما ننقل على الروم لأنه انسأل, and then we can switch to the room. So السؤال: I am currently on Cipralex treatment after monitoring. I will hopefully start decreasing the dose by January as I will be taking it for a year. Do you think it will be effective? In terms of panic attacks, I'm really feeling much better, but in terms of thoughts and fear of death and illness, no.
So I can't really be one to comment on that because I'm not a psychiatrist. So I cannot say, reducing the dose now or by how much. That's not my place. That's not my area of expertise. I would definitely, talk to the psychiatrist about it. If you have some concerns about reducing it right now, but fears or other areas to address, let your care providers know, definitely. If you haven't shared this with your care providers, let them know. And also those are things to tackle in therapy, the fears around death or health anxiety or health illness. Holy kamen can be discussed in therapy. I don't know if the person is also in therapy or not.
لا منا in therapy. So would you recommend going to therapy?
Yep. Any reason that she's not?
No, ما كتبت بس يعني إذا this is the إذا فيك تعطينا شيء advice أو تعطيها advice, should she go to therapy? Do you think it's essential also in parallel with her medication?
Yeah. Sometimes the way meds work is they treat the symptoms, but therapy treats the cause. Therapy goes deeper to understand why are we having the symptom. يعني أنا اليوم إذا حدا إجا قال لي عندي وجع راس, طب الوجع راس ممكن يكون لأنه ما شرب مي أو لأنه ما نام أو لأنه whatever. So yes, Panadol will help with the symptom, but what about what caused it to begin with? So if there's some fears around death or health anxiety, I think it might be very helpful to consider talking to someone about it.
دكتور نيكول, قد ايه كمان من خبرتك قبل ما ننقل على الروم للناس اللي عم تسمعنا واللي عم بيرجعوا يحضروا الريكوردينج, قد ايه من خبرتك بتشوفي تشينج, قد ايه بدنا وقت تيصير عنا تشينج, وهل انه نصير مثل ما قلتي to manage it, مش رح تروح بس at least to manage our panic attacks, قد ايه وقت؟
That's a good question. So as we said before, it does vary from person to person depending on what's going on with them. But in terms of learning strategies and techniques, I would say from my experience, we can see some changes being made within 10 to 15 sessions. And in that way, Sandra, يعني الشخص بيكون, let's say they're seeing their therapist مرة بالأسبوع, وإذا عم نحكي 10 to 15 sessions, عم تحكي على القليلة, let's say 3 months on average, you know, that's a really, that's an amount of time where we can start seeing change, you know. Again, it's really hard to put a number on it because someone might come in saying, okay, عندي مشكلة الpanic attack, but then in therapy, we uncover actually the panic attack was مثل وجع على الراس. It was just a symptom of other things, you know, and the other things are what need to be looked at, which could take a lot of time.
كمان دكتور, what would you comment on يعني يلي منا بعده فكر إنه it will pass, إنه هلأ يمكن عم تسمعيني؟
Yeah, I'm hearing you. Last thing I heard was it will pass.
Hello?
Sandra, I hear you, but your video is frozen. Oh no. Okay, now I cannot hear you. Sandra? Technical difficulties. ما بعرف شو صار. Okay, I think Sandra's going to rejoin. هلا بعتت message. I cannot even see the chat, يعني, at least at this time can feel to take a few questions, but I don't have access to this. So we're just going to patiently wait for Sandra to come back. Sandra, you're on mute.
Okay.
Yeah.
Can you hear me? Sorry.
No
internet connection. آخر سؤال عنا لك Dr. Nicole, what would you say to people who think that it will pass و ما رح ما بي عم تسمعينا؟
Lagging, it's lagging. This I heard, what would you say to people who say it will pass, صح?
Yes, مزبوط. إنه رح تقطع. It's okay وهلأ مرحلة وبعدين بتروح لحالها. What would you say to people who think that way? وتاني سؤال, إذا نحن شخص قريب منا is going through panic attacks, كمان شو برأيك الطريقة ندفش هالشخص أو ننصح هالشخص to take action? So هيك for parting words للناس اللي عم تحضرنا, لأنه في كتير ناس اليوم إذا مش هن كمان حدا قريب منهم is going through the same thing.
Yeah. So بالنسبة لأول part, it does pass. So it's helpful to tell ourselves it will pass or this is temporary because it does pass. But it's a whole other thing if the person is minimizing and not addressing it, right? So if a person is saying it will pass in a way to overcome it, you know, to manage it بوقتها, then that's fine. What to tell people? Well, we can say things like, I'm here for you, you know, if you want to talk about it, please feel free to open up to me. If you don't feel comfortable opening up to me, there are professionals that can help. أو نذكر الشخص إنه يكون in the present moment, because as I mentioned, sometimes our mind takes us to so many, and it's usually to very dark places and scary thoughts. So we just want to gently remind the person to bring their awareness back to the here and now. And also ask the person, إنه كيف بقدر ساعدك أو كيف بقدر ساعدك, what do you want from me? Because sometimes we assume إنه we know, but we might not really know. So let's not assume and let's ask. وكمان نذكرهم إنه يركزوا على their breathing, to help them with the breathing count. So if you're now familiar with, let's say, the 4-7-8 strategy, تعملوها مع بعض مع الشخص, and to tell them, you can get through this. It's gonna pass. I know it's hard, but yes, it will pass. So these are ways to help someone, or what to say to them لما يكون عندهم panic attack.
So a big thank you لوقتك اليوم. رح نكفل discussion معك in the room. للي عم يحضرونا, don't hesitate to reach out to Dr. Nicole. Her contact, if needed, are on the app itself. Also, you can reach out to us. Anyone at the SIRA team can provide her contacts. Also, her website حطيناه. It's also available. نحن بس رح فرجي أنا. I'll stop. I'll just share my screen and show our audience how to move to the room with us. So نحن رح نوقف الريكوردينج and we're going to move to the room. عندكم على التليفون through the app تطلعوا, you will see a section called rooms. So انتوا هلا ب round tables بدكم تكبسوا على rooms, and then you will see a room اسمها Am I having a panic attack. نحن رح نبلش الروم وبتنقلوا عليها, يعني فوتوا عليها. Inside the room مثل ما ذكرنا, you can ask your questions, you can go on camera, you can go on microphone, تحكوا معنا, تحكوا مع Dr. Nicole directly, ask her anything you would like to discuss. You can even ask anonymously مثل ما كنتوا عم تعملوا على الراوند تيبل إذا ما بدكم يعني تفصحوا عن هويتكم, وفيكم بس تتسمعوا كمان على خبرات غيركم أو experiences غيركم يلي كمان عم بيقطعوا بنفس الشيء. So Dr. Nicole, let's move to the room. أنا رح وقف الريكوردينج and we'll continue our conversations there.